One last publication to think about is the data we've seen at EHA, which was the publication in Waldenstrom's Macroglobulinemia, where rituximab was compared to the combination of ibrutinib and rituximab. And this is a mixed population of patients that included both previously untreated as well as those patients with prior therapy. And what we saw was a substantial improvement in responses, not just overall response, but the depth of responses was better in patients who had the combination compared to rituximab alone. We saw that in addition to the response rates, there was a vastly different progression-free survival between the two arms, highly favoring the combination of ibrutinib with rituximab. One of the surprise findings, however, was that the adverse event profile. I was surprised to see that the incidence of atrial fibrillation for those patients who received ibrutinib was 12% compared to 1% in the rituximab alone arm. This is surprising because we know that ibrutinib is associated with atrial fibrillation. It's just the magnitude of difference that we have seen, and not clear to me whether this is just there's something inherently different about patients with Waldenstrom's, or whether unfortunately they just got unlucky in this study and we saw that much difference. It may be something to do with the numbers of the patients that were on this trial.